All right, so we're going to move into Chapter 4, which is going to review lab values and drug monitoring. Background. Laboratory values assist healthcare providers in diagnosing and monitoring diseases and drug therapies. Blood or other samples can be sent to a hospital or an outside laboratory, or alternate methods can be used. Point of care testing provides rapid results at the site of patient care. There are many point of care tests, including tests for cardiac enzymes, A1C, INR, and various infections. Home testing kits, many of which are available over the counter, provide convenience and privacy and are available to test for things like pregnancy, ovulation, HIV infection, herpes, and blood in the stool, or the presence of illicit substances and opioids. Therapeutic drug monitoring involves obtaining a drug level or other relevant labs to monitor efficacy and safety. Therapeutic drug monitoring is reviewed in detail at the end of this chapter. In many states, providers can order and interpret lab tests for a variety of purposes, especially if you're a clinical practitioner. And this includes screening for and diagnosing diseases, monitoring blood levels and other related lab values, checking for medication adherence, and even screening for drugs of abuse. Alright, so we're going to go through definitions. So the first definition listed here is the CBC, or the complete blood count, which is a commonly ordered lab panel, and this analyzes white blood cells, red blood cells, and platelets. The CBC, or complete blood count, includes hemoglobin, which are the oxygen carrying protein in your red blood cells, and it also contains hematocrit, which is the level of red blood cells in the fluid component of the blood or plasma. So when a complete blood count, or CBC, with differential is ordered, the types of neutrophils or white blood cells are analyzed. Basic metabolic panel and comprehensive metabolic panel. The basic metabolic panel includes 7 to 8 tests that analyze electrolytes, glucose, renal function, and acid-base status. The acid-base status is looked at with the bicarbonate. Some labs calculate and report an anion gap along with the basic metabolic panel. Let's see, then we look into the comprehensive metabolic panel. This includes tests in a basic metabolic panel, plus albumin, plus alanine aminotransferase, or ALT, aspartate aminotransferase, or AST, total bilirubin, and total protein. The additional tests are used primarily to assess liver function. The basic metabolic panel and the comprehensive metabolic panel are groups of labs that are ordered together for convenience. We can review the stick diagrams below, which are used in practice when writing a paper chart note to denote the primary components of the CBC, or the basic metabolic panel. It is important that healthcare providers know which values are contained in these stick diagrams. So we may have the CBC stick diagram, which includes, again, the white blood cells, the hemoglobin and hematocrit, and the platelets, so 4 things. And then when we're looking at the basic metabolic panel, we can see that there's, across the top, sodium, chloride, and BUN, and on the bottom there's potassium, bicarb, and serum creatinine, and to the right-hand side is the glucose level. So let's review the blood cell lines. So stem cells in the bone marrow produce red blood cells, white blood cells, and platelets. White blood cells can be called leukocytes. Red blood cells can be called erythrocytes. An immature red blood cell is called a reticulocyte. So if we're looking at the chart on page 68, we can see that we have some conditions listed. So under the heading of increase in individual cell lines, so for increase we show, like, if you have an increased white blood cell count, an increased red blood cell count, and increased platelets. So like if you have thrombocytosis, you have increased platelets. If you have polycythemia, then you have increased red blood cells. And if you have increased white blood cells, you have leukocytosis. Looking at the heading of decrease in individual cell lines. So here we're thinking decrease of platelets, decrease of red blood cells, or decrease in hemoglobin, and decrease in white blood cells. So if we have a reduction in platelets or reduced platelets, we experience a condition called thrombocytopenia. If we have reduced hemoglobin and reduced levels of red blood cells, the patient would be considered anemic. Or to have anemia. And if the patient is experiencing reduced white blood cell counts, the patient is thought to be experiencing leukopenia. So if you have a decrease in, instead of individual cell lines, but you have a decrease in multiple cell lines, then it would be known as myelosuppression. So here you would have reduced white blood cells, reduced red blood cells, and reduced platelets. And there's also, under decrease in multiple cell lines, the reminder of agranulocytosis. So if a patient has agranulocytosis, they have decreased granulocytes. So the white blood cells that have secretory granules in the cytoplasm are granulocytes, and those would be reduced. And this includes a decrease in the neutrophils or the white blood cells, a decrease in also basophils and eosinophils. Some drugs can cause a granulocytosis, so we can review that: clozapine, propylthiouracil, methimazole, procainamide, carbamazepine, and Bactrim, sulfamethoxazole trimethoprim, as well as isoniazid, can all cause a granulocytosis. All right, so moving on, we're still on page 68. Lab results. So lab results are usually reported as a numerical value. Some are reported as positive or negative or indicate a specific finding, like a gram-positive cocci. Reference ranges can vary slightly from one facility to another. And this is due to slight variances in products and techniques. And reference ranges can also vary between pediatric and adult populations. A patient's lab results can be within the reference ranges, normal, or outside of the reference ranges. So outside of the reference range for labs can indicate a condition that needs to be addressed. A value that is termed critical can be life-threatening unless corrective action is taken quickly. The Joint Commission requires that all accredited facilities create and follow a protocol to identify and report critical values to the responsible healthcare provider who has established time frame to manage the result. This applies to critical lab values and diagnostic procedure results. The next heading on page 69 is common laboratory reference ranges for an adult. So reference ranges for labs are generally provided on our exams, but may not be provided on the CPJE. Familiarity with lab tests and their interpretation will greatly reduce the time required to evaluate cases on the exam. Must-know labs for healthcare providers are going to be in bold in the following tables, though others are likely to be included in the specific patient case. The reference range for a healthy adult is provided typically unless otherwise noted. Drugs specifically indicated to treat a lab abnormality, for example, urate-lowering therapies, are included in their respective chapters. Like you would want to look at the gout chapter if you're considering urate-lowering therapies. Studying this table will be much easier after mastering all of the associated disease state chapters in the book. So if we're just going to review briefly, we'll go through the lab value and then we'll go through definitely the notes. So on page 75, there's the heading of Assessing Patient Cases Quickly. Cases can be evaluated more quickly by recognizing lab patterns and signs and symptoms that provide a clue to the patient's diagnosis. Watch for drug-induced signs and symptoms and lab changes. Look for lab contraindications to drugs. Additional information can be found in the chapters, again, on these disease states. Lab patterns and likely diagnoses can be located in the first chapter of this course book. Lab patterns due to an infectious disease can be found in the infectious diseases chapter. And the last reminder of chapter 4 is going to look at therapeutic drug monitoring. So drug levels or other values such as anti-alpha A levels for low molecular weight heparins are used to reach dosing goals and avoid toxicity. Therapeutic drug monitoring is increasingly common due to the need to target highly resistant infectious organisms and dose the medications properly in overweight and obese patients. The peak level is the highest concentration in the blood a drug will reach. It requires time for the drug to distribute to the body's tissues. The trough level is the lowest concentration a drug will reach in the blood and is drawn right out before the next dose or some short period of time before the next dose. There is a reminder that the trough level is often drawn 30 minutes before the next dose. This allows time to assess the level before another dose is given. So the next dose can be withheld if the level is high. The time that drug levels are drawn is critical for accurate interpretation. For example, with tobramycin, level of 6 microgram per milliliter would be interpreted differently if the level was a trough versus peak. Obtaining drug levels at steady state is often, but not always, preferred. And we can revisit the pharmacokinetics chapter to go into further discussion on therapeutic drug monitoring. As a reminder, narrow therapeutic index drugs have a narrow separation between the low or subtherapeutic and the desired or therapeutic and supratherapeutic high drug levels. So with the narrow therapeutic index drugs, there's the reminder that the supratherapeutic levels, high drug levels, could actually be toxic. Therapeutic drug monitoring is commonly performed by a clinical pharmacist, and the following key drugs that are listed are routinely monitored. These drugs and usual therapeutic ranges are felt to be essential for the exams. And again, that is page 76, which has its own chart on therapeutic drug levels. And then we're gonna have 1, 2, 3, 4, 5, 6, 7 charts of common lab reference ranges for adults. So for now, we'll go ahead and we'll pause here on page, we'll go back to page 69 of chapter 4, and then we'll do a part 2 and maybe a part 3 on the lab values and the notes.